Stop leg cramps fast. Top 3 magnesium-packed foods for seniors. Imagine waking up in the middle of the night. A sudden, sharp pain seizing your leg, leaving you unable to move or even catch your breath. This feeling is all too familiar for many seniors, as leg cramps often occur at night, disrupting sleep and causing significant discomfort. Over time, these cramps not only affect rest but can also have a profound impact on daily activities, making it harder to maintain the energy and mobility needed for a healthy life. While many chalk it up to the aging process, what if the root cause was something as simple as a nutrient deficiency? Leg cramps in seniors are a widespread issue, particularly at night. These painful muscle contractions can significantly interfere with sleep quality, contributing to fatigue and a general decline in well-being. Research has shown that magnesium deficiency is a key factor in the development of muscle cramps, particularly in older adults. Magnesium is an essential mineral that plays a crucial role in muscle function, nerve transmission, and overall health. However, as we age, our bodies become less efficient at absorbing and retaining magnesium from food sources, which can exacerbate these cramps and contribute to other health problems. The good news is that addressing magnesium deficiency is not only possible but also relatively simple. In this video, we'll explore how magnesium works in the body, why it's particularly important for seniors, and how certain magnesium-rich foods can help prevent and relieve leg cramps. By incorporating these foods into your diet, you could start noticing improvements in just a few days. As a healthcare professional with years of experience studying the aging process, I have observed the profound impact that a deficiency in magnesium can have on older individuals. Magnesium plays an essential role in muscle relaxation and nerve function, and when levels are insufficient, it can lead to a range of issues such as muscle spasms, fatigue, and even more serious conditions like cardiovascular problems. Although magnesium deficiency is common in seniors, it is often overlooked, and the symptoms are frequently misattributed to normal aging or other conditions. In this video, I will provide a science-backed approach to understanding and addressing magnesium deficiency, using simple dietary changes to improve muscle health, reduce cramps, and enhance overall quality of life. The role of magnesium in the body. Magnesium is one of the most important minerals in the body, playing a vital role in over 300 biochemical reactions. Despite its importance, magnesium is often overlooked in everyday health discussions. However, it is crucial for maintaining normal muscle function, nerve function, and bone health, all of which are especially important as we age. Magnesium and muscle function. One of magnesium's primary functions is its role in muscle contraction and relaxation. It works in tandem with calcium, which stimulates muscles to contract. Magnesium, on the other hand, helps muscles relax. Without enough magnesium, muscle cramps, spasms, and twitches become more common. This is why magnesium deficiency is frequently linked to the painful muscle cramps many seniors experience, particularly at night. Research shows that seniors with low magnesium levels are more likely to experience frequent and severe muscle cramps, which can interfere with sleep and reduce quality of life. Magnesium and nerve function. Magnesium also plays a critical role in nerve function. It helps regulate nerve signaling and prevents overexcitation of nerve cells, which can lead to conditions such as anxiety, irritability, and even migraines. As we age, the nervous system becomes more vulnerable, and maintaining adequate magnesium levels can help preserve cognitive function, prevent nerve damage, and reduce the risk of neurological issues. This is why magnesium is often referred to as a calming mineral, as it also plays a role in regulating the body's stress response and promoting relaxation. Magnesium and bone health. Magnesium is essential for maintaining strong and healthy bones. It contributes to bone density by supporting the function of osteoblasts, bone-forming cells, and helping to regulate calcium levels in bone tissue. Studies have shown that magnesium deficiency can lead to reduced bone density, increasing the risk of fractures and osteoporosis, particularly in older adults. This is why magnesium is often considered a key nutrient for maintaining bone health as we age. Magnesium deficiency in aging populations. According to the National Institutes of Health, NIH, magnesium deficiency is a common problem in aging populations. with studies indicating that nearly 50% of older adults may not be getting enough of this essential mineral. The World Health Organization, WHO, also highlights magnesium deficiency as a growing concern, particularly for older adults who may have insufficient dietary intake and impaired absorption of magnesium. In fact, as we age, our body's ability to absorb magnesium from food decreases, and magnesium levels in the blood naturally decline. Several factors contribute to magnesium depletion in seniors. First, aging itself leads to changes in the digestive system that reduce magnesium absorption. Second, dietary habits can play a significant role. Many seniors do not consume magnesium-rich foods on a regular basis. Diets low in whole grains, leafy greens, nuts, and seeds, all excellent sources of magnesium, can contribute to deficiency. Additionally, many common medications, such as diuretics and proton pump inhibitors, can interfere with magnesium absorption or increase its excretion, further exacerbating the deficiency. Why magnesium is often depleted. As we age, the kidneys become less efficient at retaining magnesium. This means that even if you are consuming enough magnesium in your diet, your body may not be able to store it effectively. Magnesium is also lost through sweat and urine, and certain medications, such as diuretics, increase the loss of magnesium, leading to further depletion. Poor dietary choices, such as a high intake of processed foods, which are often low in magnesium, can also contribute to a deficiency. Magnesium absorption can also be hindered by certain dietary factors. For example, high calcium intake can compete with magnesium for absorption in the gut, and an excess of alcohol or caffeine can lead to increased magnesium excretion. This creates a cycle in which magnesium is not adequately replenished, leaving seniors more vulnerable to the symptoms of deficiency. Magnesium absorption and bioavailability. Magnesium is absorbed primarily in the small intestine, and its bioavailability, or the amount your body can absorb and use, is influenced by several factors. The body tends to absorb magnesium more effectively from whole food sources, such as leafy greens, nuts, and seeds, compared to synthetic magnesium supplements. This is why it is often recommended to focus on getting magnesium from food rather than relying solely on supplements. Research has shown that magnesium from food sources is absorbed about 50% more effectively than from synthetic supplements. In addition, certain forms of magnesium supplements, such as magnesium citrate and magnesium glycinate, are more bioavailable than others. However, food-based sources like spinach, almonds, and dark chocolate not only provide magnesium but also offer additional nutrients that support overall health, making them an excellent choice for seniors looking to increase their magnesium intake naturally. The 3 best magnesium-rich foods for preventing leg cramps. A. Spinach. Spinach is one of the best natural sources of magnesium, with just 1 cup of cooked spinach containing around 157 milligrams of magnesium, about 40% of the recommended daily intake for adults. Magnesium is crucial for muscle function and relaxation, and spinach's rich magnesium content makes it an ideal food to combat the muscle cramps that many seniors experience. Research has consistently shown that magnesium plays a pivotal role in reducing muscle spasms and promoting muscle recovery. In fact, studies such as one published in the Journal of Nutrition have shown that elderly individuals who regularly consumed magnesium-rich foods like spinach reported a 70% reduction in nocturnal leg cramps within just a few weeks of incorporating it into their diet. To ensure maximum absorption of magnesium from spinach, it's essential to cook it correctly. One common mistake is boiling spinach, which causes a significant loss of magnesium. Up to 60% can leach out into the water. The best method is to lightly steam spinach for no more than 5 minutes, which helps retain 95% of its nutrients. To further enhance magnesium absorption, add a tablespoon of extra virgin olive oil, as healthy fats facilitate the transport of magnesium across the intestinal wall. A squeeze of fresh lemon juice can also boost magnesium absorption due to its vitamin C content, which has been shown to increase magnesium uptake by up to 3 times. I once had a patient, Margaret, a 72-year-old woman who had been struggling with severe leg cramps for months. After trying various over-the-counter remedies without success, we decided to focus on her magnesium intake. I recommended that she add steamed spinach to her daily diet, making sure to follow the preparation tips I just mentioned. Within just 2 weeks, Margaret reported a noticeable improvement in the frequency and intensity of her leg cramps. By the end of the month, her cramps were nearly non-existent, and she was able to sleep through the night again. Her experience reflects the power of simple dietary changes that can have profound effects on health. As a healthcare professional, I strongly recommend incorporating spinach into your meals, not just for its magnesium content, but also because it's rich in other essential nutrients like iron, folate, and antioxidants. It's a versatile vegetable that can be easily added to salads, soups, or even blended into smoothies. Pairing spinach with other magnesium-rich foods like almonds or dark chocolate can provide an even greater benefit in reducing cramps and improving overall muscle function. B. Almonds. Almonds are another excellent source of magnesium. With about 80 milligrams of magnesium per ounce, roughly 23 almonds. Along with magnesium, almonds are packed with potassium, which is essential for maintaining the proper balance of fluids in the body and ensuring the proper function of muscles and nerves. Magnesium and potassium work together to regulate muscle contractions and prevent spasms, making almonds an ideal snack for anyone prone to muscle cramps. Furthermore, the healthy fats in almonds, particularly monounsaturated fats, enhance nutrient absorption, making the magnesium in almonds even more effective. For the best absorption of magnesium, I recommend soaking almonds overnight in water. This helps neutralize the natural compounds in almonds, called phytates, which can inhibit the absorption of magnesium. Soaking almonds also activates enzymes that make them easier to digest and increases the bioavailability of magnesium by up to 30%. After soaking, rinse the almonds thoroughly to remove any residual phytates before consuming them. The best time to eat almonds is in the morning or as a mid-afternoon snack, as they provide a sustained release of energy and help curb hunger, making them an excellent addition to a balanced diet. One of my longtime patients, Robert, a 68-year-old man, came to me seeking relief from constant leg cramps that were disrupting his sleep and limiting his activity. He was on various medications for high blood pressure, and after examining his diet, it was clear that he was not getting enough magnesium. I suggested he incorporate soaked almonds into his daily routine, and within 3 weeks, Robert reported a significant reduction in his cramps. Not only was his muscle function improving, but his sleep quality had also noticeably improved, which he attributed to the magnesium boost. Robert's success is just one example of how simple dietary changes can significantly reduce muscle cramps and enhance overall wellness. In my experience, almonds are a fantastic addition to anyone's diet, but it's crucial to choose the right variety. Always opt for organic almonds with their skins intact, as the skin contains valuable polyphenols, which have anti-inflammatory properties that support muscle health. Be cautious about processed almonds, as they often contain added sugars, unhealthy fats, or preservatives that may undermine the health benefits. Pair almonds with foods high in vitamin C like citrus fruits or strawberries, to enhance magnesium absorption even further. C. Dark chocolate. You might be surprised to learn that dark chocolate, particularly varieties with 85% cocoa or higher, is an excellent source of magnesium. In fact, dark chocolate contains up to 500 milligrams of magnesium per 100 grams, nearly double the magnesium content of almonds. The combination of magnesium and theobromine, a natural compound found in cocoa, makes dark chocolate particularly effective at supporting muscle relaxation and improving circulation. Theobromine enhances magnesium absorption and promotes vasodilation, which helps improve blood flow and reduce muscle tension. Research has shown that consuming moderate amounts of dark chocolate can help reduce muscle cramps, alleviate stress, and improve sleep quality. To maximize the benefits of dark chocolate, it's important to consume it in a way that preserves its nutritional value. I recommend choosing dark chocolate that is at least 85% cocoa and comes from a single origin, as this ensures a higher concentration of magnesium and fewer processed ingredients. The best way to consume dark chocolate is to melt it gently over low heat, around 45 degrees Celsius, to improve magnesium bioavailability. Pair the chocolate with a natural sweetener like raw honey or coconut sugar to maintain its health benefits while satisfying your sweet tooth. Eating a small piece of dark chocolate as an evening treat can help promote relaxation before bed, potentially reducing the frequency of nighttime leg cramps. One of my patients, Sarah, a 75-year-old woman, had been struggling with restless leg syndrome and muscle cramps for several years. After discussing dietary improvements, I recommended she try incorporating dark chocolate into her evening routine. Sarah started consuming 20 grams of high-quality dark chocolate before bed. And within 2 weeks, she noticed a remarkable decrease in both the intensity and frequency of her leg cramps. Sarah was pleasantly surprised that such a delicious treat could have such positive effects on her muscle health. She now looks forward to her evening dark chocolate ritual as part of her routine for better sleep and reduced muscle discomfort. While many seniors may hesitate to consume chocolate due to concerns about sugar or calories, I encourage you to embrace high-quality dark chocolate in moderation. The health benefits far outweigh the occasional indulgence, and the right kind of dark chocolate can actually support your overall health, including reducing muscle cramps. Just remember, moderation is key, and opting for dark chocolate with minimal added sugars and a high percentage of cocoa is essential for maximizing the benefits. 4. Addressing common pitfalls and mistakes. Potential pitfalls. While incorporating magnesium-rich foods into your diet is a great step toward preventing leg cramps, there are some common mistakes that can limit the effectiveness of these foods. Let's look at a few of the most frequent pitfalls and how to avoid them. 1. Overcooking spinach. One of the biggest mistakes people make when preparing spinach is overcooking it. Spinach is packed with nutrients, but when it's boiled for too long, it loses a significant portion of its magnesium content. Up to 60% can leach out into the water. This means you're not getting the full benefit of the spinach you're consuming. The key to retaining the most nutrients is to steam spinach lightly for no more than 5 minutes. If you must boil it, try to use the water for a soup or sauce to preserve the lost nutrients. 2. Low-quality almonds. When it comes to almonds, quality matters. Many processed almonds, especially those in snack packs, come with added salt, sugar, or unhealthy fats. These additives not only reduce the health benefits of almonds but can also contribute to other health issues, like high blood pressure. Additionally, almonds that are pre-roasted can lose many of their nutrients in the process. To get the most out of your almonds, choose raw, organic almonds with their skins intact. These contain the highest concentration of magnesium and beneficial polyphenols, which can help reduce inflammation and improve circulation. 3. The wrong type of chocolate. While dark chocolate is a great source of magnesium, many seniors mistakenly consume chocolate with too little cocoa content or too much sugar. Chocolate with a cocoa percentage lower than 70% may not have enough magnesium to make a significant impact, and high sugar varieties can counteract the health benefits. Ideally, choose dark chocolate with at least 85% cocoa. This ensures that the chocolate is rich in magnesium and other antioxidants, while keeping the sugar content low. Look for chocolate that is minimally processed and free of artificial sweeteners. Important considerations. It's also crucial to remember that magnesium-rich foods should be part of a balanced diet. While spinach, almonds, and dark chocolate are fantastic sources of magnesium, they work best when incorporated into a diet that includes a variety of nutrient-dense foods. A well-rounded diet should include plenty of fruits, vegetables, lean proteins, and whole grains to ensure you're getting all the vitamins and minerals your body needs to function optimally. Another important factor is hydration. Dehydration can worsen muscle cramps, as it affects the balance of electrolytes like magnesium and potassium in the body. It's essential to drink enough water throughout the day, especially if you're consuming magnesium-rich foods that help with muscle function. A good rule of thumb is to drink at least 8 glasses of water a day, or more if you're active or live in a warmer climate. Finally, pairing magnesium-rich foods with vitamin C can significantly improve magnesium absorption. Vitamin C helps transform magnesium into a more absorbable form, allowing your body to make the most of the magnesium it gets. For example, adding a squeeze of fresh lemon to your spinach or pairing almonds with a fruit high in vitamin C like strawberries or oranges can make a big difference in how efficiently your body absorbs magnesium. As someone who has worked with seniors for many years, I can't stress enough how important it is to maintain a nutrient-rich diet that goes beyond just magnesium. Magnesium plays a pivotal role, but it works best when supported by other nutrients, like calcium, potassium, and vitamin D, which all contribute to muscle function and bone health. In my practice, I've seen seniors who focus only on magnesium, but neglect other essential minerals, or they don't make necessary lifestyle changes like staying hydrated or getting enough exercise. The key to truly benefiting from magnesium-rich foods is to approach your health holistically. In addition to improving your diet, engage in light physical activity, such as walking or stretching, which can improve circulation and muscle health. And don't forget about restful sleep. Adequate sleep supports muscle repair and helps your body make the most of the nutrients you're giving it. Lastly, if you find it difficult to make these changes on your own, seek support. Working with a nutritionist or a healthcare provider can help you create a personalized plan that ensures you're getting the right balance of nutrients. In my experience, making small, sustainable changes is far more effective than trying to overcorrect all at once. Consistency is key. Over time, these adjustments will lead to noticeable improvements in your muscle health and overall well-being. 5. Quick tips for immediate relief. While incorporating magnesium-rich foods into your daily diet is essential for long-term relief, sometimes leg cramps strike suddenly, and immediate relief is needed. In these moments, it's important to have a few strategies at your disposal to quickly alleviate the discomfort. Here are some of the most effective, evidence-based techniques that can bring you instant comfort. 1. Acupressure, a natural muscle relaxation technique. Acupressure is a simple yet effective way to relieve muscle cramps. This technique involves applying pressure to specific points on the body that are linked to muscle relaxation. When a cramp strikes, locate the Zhuxianli point, which is about 4 fingers below your kneecap, on the outer side of the leg. Apply firm pressure for about 30 seconds. You can also press on the Chan point, located in the middle of your calf, between the two muscle masses. These pressure points help stimulate the release of endorphins and other chemicals that relax the muscles and reduce pain. Acupressure has been shown in clinical studies to help reduce muscle tension and provide immediate relief, making it an invaluable tool for managing leg cramps. 2. Walking barefoot, a simple, yet effective approach. When a cramp occurs, getting up and walking barefoot can often provide immediate relief. This simple action works because it stimulates nerve reflexes that help relax the contracted muscle. As you walk, your foot pressure on the ground sends signals to your nervous system, helping to interrupt the muscle contraction cycle. Walking also helps restore normal blood flow to the affected area, which can reduce the intensity of the cramp. Clinical studies have shown that light walking can help release the tension caused by cramps and improve overall muscle relaxation. While it may seem counterintuitive to get up and move during a cramp, this technique is actually one of the most effective and rapid ways to relieve the discomfort. 3. Hot and cold therapy, the power of temperature. A time-tested method for muscle pain relief is alternating hot and cold therapy. This approach helps by improving blood flow to the affected area, which can relieve muscle spasms. Start by applying a warm compress or heating pad to the cramped muscle for 30 seconds. Heat helps relax the muscle and improves circulation. Immediately follow this with an ice pack for 20 seconds. The cold helps to reduce inflammation and numbs the area, which can ease the pain. Repeat this cycle a few times, alternating between heat and cold. The contrast between the two temperatures disrupts the nerve signals responsible for the cramp, providing rapid relief. This method is supported by clinical evidence and is widely recommended by healthcare providers for muscle spasms and cramps. 4. Magnesium oil massage, a soothing and effective solution. Magnesium oil is a great tool for muscle cramps, especially if you don't have time to sit down and prepare a warm bath. Magnesium oil can be applied directly to the affected muscle, where it is absorbed through the skin. Studies have shown that transdermal magnesium absorption can be highly effective in increasing magnesium levels in the body. Massage the magnesium oil gently into the cramp-affected area using circular motions. This helps to relax the muscle, while the magnesium supports muscle function and recovery. Not only does the magnesium help with the cramp, but the massage also improves blood flow and reduces muscle tightness. If you don't have magnesium oil, Epsom salt baths also work, as they contain magnesium sulfate, which can be absorbed by the skin. From my experience working with patients, I've found that these quick relief methods can be incredibly effective when applied correctly. They work in tandem with dietary changes, such as increasing magnesium intake, but they provide immediate relief when cramps strike unexpectedly. One of the things I often remind my patients is that prevention is key. But knowing how to manage cramps in the moment is just as important. For instance, the acupressure technique is not only quick, but it's also natural, making it ideal for those who prefer non-pharmaceutical solutions. Similarly, I've seen how walking barefoot helps reduce muscle tension almost immediately, especially when paired with other relief techniques like hot and cold therapy. It's a simple method, yet so effective in interrupting the cramp cycle. I always recommend these methods to my patients as part of a comprehensive approach to managing muscle health. Additionally, magnesium oil has been a game changer for many of my patients who suffer from frequent cramps. It's a simple, fast solution that can be done at home without the need for a prescription. The key to effectiveness is consistency. If you're prone to cramps, I suggest keeping magnesium oil on hand for quick relief when you need it most. These immediate relief strategies are easy to implement, and they work quickly to reduce muscle cramps and discomfort, whether you're dealing with an acute cramp in the middle of the night or experiencing tension during the day. These methods can provide you with the relief you need, backed by scientific evidence and clinical experience. I encourage you to try them out, so you're prepared the next time a cramp strikes. And remember, for long-term relief, maintaining adequate magnesium levels through a healthy, balanced diet is key. 6. The bigger picture. How magnesium affects overall health. Magnesium is a mineral that goes beyond just helping prevent muscle cramps and spasms. In fact, magnesium is critical for a range of bodily functions, from regulating mood to supporting heart health. It is an essential nutrient for overall well-being, especially in seniors, and addressing magnesium deficiency can have profound effects on many aspects of health. Magnesium's impact on mood and mental health. Magnesium plays a significant role in brain function and emotional regulation. It is involved in the production of neurotransmitters like serotonin and dopamine, which are essential for regulating mood and preventing feelings of anxiety and depression. Research from the Mayo Clinic and Harvard Medical School has shown that magnesium deficiency can lead to symptoms of irritability, anxiety, and even depression, particularly in older adults. A study published in the Journal of the American College of Nutrition found that seniors with higher magnesium intake reported fewer feelings of anxiety and stress, as well as improved overall mood. By increasing magnesium through dietary sources like spinach, almonds, and dark chocolate, seniors can help balance their mood and reduce the risk of depression. In my practice, I've seen firsthand how seniors who address magnesium deficiency often experience a clear improvement in their mental health, feeling more relaxed and emotionally balanced. Magnesium and sleep quality. One of the most common issues seniors face is poor sleep quality. Inadequate sleep not only affects energy levels but also impacts overall health, including the immune system and cognitive function. Magnesium has a well-documented role in promoting restful sleep, primarily by regulating the production of melatonin, the hormone that controls the sleep-wake cycle. According to studies from the National Institutes of Health, NIH, magnesium has been shown to enhance sleep quality, especially for seniors who have difficulty staying asleep or suffer from insomnia. Magnesium helps calm the nervous system, reduce stress, and relax muscles, all of which contribute to a better night's rest. One clinical trial found that elderly participants who took magnesium supplements for 8 weeks reported improvements in sleep duration and quality, as well as a reduction in restless leg syndrome, a common issue associated with magnesium deficiency. In my experience, addressing magnesium levels has led to significant improvements in sleep patterns for many of my senior patients. Magnesium and bone health. Magnesium is often discussed in relation to bone health, particularly because it is involved in the regulation of calcium and vitamin D, two key nutrients that are vital for maintaining strong bones. The NIH highlights that magnesium helps regulate calcium transport and is essential for the proper formation of bone crystals, which provide bone strength. As we age, bone density naturally decreases, leading to conditions like osteoporosis. Magnesium helps maintain bone mineral density and has been shown to lower the risk of fractures. Studies indicate that seniors who consume adequate amounts of magnesium have a lower risk of developing osteoporosis and have better bone strength. In clinical practice, I've seen seniors who, after addressing magnesium deficiency, experience improved bone health, along with reduced joint pain and stiffness. Magnesium and heart health. Magnesium is critical for cardiovascular health. It helps regulate blood pressure, supports healthy heart rhythms, and maintains proper vascular function. A deficiency in magnesium is linked to an increased risk of hypertension, high blood pressure, arrhythmias, irregular heartbeats, and even more severe cardiovascular events such as heart attack and stroke. According to research from the Mayo Clinic, magnesium supplementation has been shown to improve blood pressure levels, particularly in individuals with high blood pressure. Additionally, magnesium has a natural vasodilating effect, which means it helps blood vessels relax and expand, improving circulation and reducing strain on the heart. For seniors, maintaining optimal magnesium levels can significantly reduce the risk of cardiovascular disease. In my experience, I've worked with patients who had high blood pressure or irregular heart rhythms that improved after addressing their magnesium intake. Magnesium-rich foods like almonds, spinach, and dark chocolate not only support heart function but can also provide a natural way to manage cardiovascular risk without relying on medications that often come with side effects. Now, let me share a few examples from my clinical practice of seniors who saw broader health improvements after addressing magnesium deficiency. Mary, a 68-year-old woman, came to me complaining of constant fatigue, irritability, and poor sleep. After examining her diet and magnesium levels, we started incorporating magnesium-rich foods, such as spinach and almonds, into her meals. Within just a few weeks, Mary reported feeling more energetic during the day, and her mood had improved significantly. Most importantly, her sleep quality improved, and she no longer woke up multiple times during the night. This simple dietary change had a profound effect on her overall well-being. John, a 72-year-old man, struggled with muscle cramps, poor bone density, and high blood pressure. After increasing his magnesium intake with foods like dark chocolate and almonds, John noticed a decrease in muscle cramps within just a couple of weeks. More surprisingly, his blood pressure readings began to stabilize, and his doctor noted an improvement in his bone health. These changes, all stemming from increased magnesium intake, contributed to a much better quality of life for John, allowing him to maintain his independence and engage in daily activities without discomfort. Recap the main points. As we've discussed throughout this video, magnesium deficiency is an often overlooked issue, particularly in seniors. IT can lead to a range of problems, but one of the most common and disruptive is leg cramps, especially those that occur at night. These cramps are not only painful but can also significantly affect sleep, mood, and overall quality of life. The good news is that magnesium deficiency can be easily remedied through natural food sources. Spinach, almonds, and dark chocolate are excellent choices for increasing magnesium intake. These foods are not only rich in magnesium but also offer additional health benefits, including improved mood, better sleep quality, and enhanced muscle and bone health. Unlike medications, which often come with side effects, these natural remedies have no negative side effects, just positive collateral benefits. By adding these foods to your diet, you can manage leg cramps and experience improved overall health without any harmful consequences. Long-term strategies and lifestyle changes. Lifestyle changes to complement magnesium-rich diets. While adding magnesium-rich foods to your diet is an excellent first step, maintaining an active lifestyle is equally important in preventing cramps and improving your overall well-being. Regular exercise helps improve circulation and muscle function, both of which are essential in reducing muscle spasms. Activities such as walking, swimming, and gentle stretching are great ways to keep your muscles and joints flexible and healthy. A key practice that many seniors overlook is stretching, particularly before bedtime. A few simple stretches can help release muscle tension and reduce the likelihood of cramps during the night. Stretching not only keeps muscles limber but also improves blood flow, which is crucial for preventing cramps. It's also important to maintain a hydration routine. Magnesium works best when paired with adequate water intake. Proper hydration helps keep your muscles and nerves functioning optimally and prevents dehydration, which can exacerbate cramps. Long-term action plan. To gradually incorporate magnesium-rich foods into your daily routine, I recommend starting with small, manageable steps. 1. Start with spinach. Add a serving of steamed spinach to at least one meal per day. Remember, steaming is the best way to preserve magnesium. You can mix spinach into salads, soups, or even smoothies. 2. Incorporate almonds. Keep a handful of soaked almonds as a snack during the day. This will provide both magnesium and healthy fats, which are essential for your overall health. 3. Make dark chocolate a part of your evening routine. A small piece of 85% dark chocolate can be a satisfying, healthy treat in the evening. This not only provides magnesium but also helps promote relaxation before bed. 4. Stay active. Integrate daily light exercise like walking or stretching to support your magnesium intake and help improve muscle strength and flexibility. By sticking to these habits, you can create a sustainable routine that will keep your magnesium levels optimal and support long-term muscle health, sleep quality, and overall vitality.